Go. I think Broward had started to go up, then went down, then kind of went back up. But I'll let the Surgeon General kind of explain, what data we're looking at.
I mean, the most important data that we're looking at is testing. As the governor mentioned, now more than 8,800 test results are back in, and many more are pending, and that's really what we're looking at the present time. As the governor mentioned, we have surveillance systems which are out there. In Broward, we actually saw a spike in individuals present to emergency rooms with fever and cough, but actually that dropped down over the past couple of days.
But isn't that too late? I mean, by the time you get to an emergency room,
And we also have, you actually have seen over the last week an increase in the availability of hospital beds throughout the state of Florida. And so, but Scott and his team are tracking that, and and here's the thing though to think about too. Even the people that present with fever, cough, shortness of breath, and then get tested, the overwhelming percentage of them come back negative. And so, we've tested, I mean, particularly for folks who are, in that 65 and plus, I mean, the vast majority are coming back negative.
What is the timeline on getting the 2 Tampa Bay drive-through testing stations open?
So there's already some doing it. I mean, I've talked to some of the hospital folks in that area. I think Baycare has done some stuff. So there should be some stuff already. The Raymond James site, we want to support. We're working with Tampa General. I know the city of Tampa is doing a lot on that. I'm not sure on the timeline on that, but if you look, you're starting to see more cases in Hillsborough County. We obviously anticipate because the results are coming from the prior 2 weeks mostly in terms of infections. So we really want to get a good handle on what's going on in Tampa and Orlando in particular. We know obviously South Florida is a challenge now, but we still have the ability to contain some of this in some of these other parts of the state. I mean, you look, it's interesting. Sarasota County, they've tested a lot. I mean, they've really done a good job with testing, and they've had very few infections, even though they've tested a lot. So, but yeah, we want to do it. I've been talking with John Corus at Tampa General. They're working really hard, but we definitely think that would be beneficial.
Governor, and you were talking earlier about some of the things that you were considering. I'm curious as to whether or not you've looked at what's happened in New York or California or even China. For instance, China put in clinics where they would, if somebody was in a family got sick, they took them out of the family and they quarantined them somewhere else. You see New York and California
Yeah, so so we are still like with China. What China started figuring out was, and as much as you can believe them, but people would be infected and they'd send them home and they'd infect the people in their house. And so one of the things that can be that's one of the reasons Jared's identifying some of these places, because I think the plan would be if you have somebody that presents but doesn't require hospitalization, you test them, you have them be isolated in a convention center, hotel. Don't go back home with your family, because the people you're most likely to affect are those very close, persistent contacts. Not just walking by someone it's the close contacts. If you're inside sharing a house with somebody, those are obviously the ones. So yeah, we're absolutely considering that. And actually, I mean, hopefully, it doesn't get to that, but we're planning for that for sure, because I think that that's the prudent thing to do. Yes, ma'am.
I'm sorry to get to my question, but my question was more upon the fact if you've seen things that other states and their nations are doing that you said, no, that didn't work, so let's go in a different direction. That was sort of where I was trying to
Well, so, I would just say, obviously a lot's going on in New York. New York's numbers are off the charts. They have over 10,000 infections. Obviously, they have New York City, which is kind of the perfect place where something like this would spread. Very urban, people always in close contact, public transportation, and there's other things involved in that. So you look at that, but then you also got to see what they're dealing with in their circumstances versus here, and then make the decisions. I would say the big problem with a lot of this stuff is, nobody really has adequate data that they can really say, what's going to happen when you do X or Y. A lot of these are built on assumptions and models, and I respect that. But I know California said that maybe half their state would be infected, and that was an analysis I looked at, and I wasn't sure that was something that I necessarily bought into, because if you look at Italy, I think they have 60 million people. They had, as of like yesterday, I think they had about 40,000 infections. And so there's a lot of this that's really driven by assumption. So you just got to try to get as much information as you can. What are the actual facts? You talk to folks on the ground. You talk to folks. The president's task force has been great. I mean, you call, we've talked Dr. Fauci a number of times, talked to, the U.S. Surgeon General a number of times, VP. They've been really, really good and really, really helpful. Yes.
So I wanted to ask you about Medicaid. I know some Democratic lawmakers have sent you letters about that. I know that you're doing the 2 months where if you're up for recertification, you're delaying that. But what about actually temporarily extending or expanding Medicaid to people who aren't ordinarily eligible for that?
Well, so on this, the testing's free. You're going to be taken care of. I mean, I know, like in a normal situation, this is an emergency situation. So if someone presents themselves, at the county health department, we're going to work to take care of them. I'm not sure I can just unilaterally do some of that stuff, anyways. So people are going to be taken care of, and people can know if you have these symptoms. And you talk to a physician, if you call the county health, whoever you talk to recommends the test, you're not going to have to pay for the test. I mean, you're going to be fine.
Yeah, Governor, you mentioned these putting drive-through testing sites in hotels, which is something that China has.
Well, no. So with the hotels, let me be clear. The hotels, I think, would be more for what Gary was mentioning, what China did by self-isolating the people who were suspected of carrying it rather than send them home. I think that would probably be, what we would use a hotel or some of those big areas for.
Okay, so is this an idea where people who test positive would go to the hotel, stay at these hotels, or people who have fever
or people who have symptoms and we don't know the test result, so you would go there. But yes, I mean, I think we want a place where positive cases can be self-isolated in a way that they're not going to infect other people. And, with all this stuff about, we tell people, obviously, use your good judgment about staying away from people, cleanliness. But if you have a household of 5 and you infect the people, people go out, kids go out, all these people will do stuff. And, as much as government can say, don't do this, don't do that, I mean, people still do it. So if you just take that out of the equation, then all of a sudden you take somebody, they're having no more contacts for that period until they're not contagious, and then I think it helps you get a handle on it. So we will look at, and really I was surprised that people have said, look, we're not using these things anymore. Obviously, we got to get behind this, get past this. So let's try to make good use of it, and that could be a way to be able to do it. So, but I'll have a an update on the Villages plan tomorrow. I think I've mentioned before, it's drive-through testing Villages style, where they're going to be taking their golf carts through to get swabbed as they're going through. And they've really, because obviously their population is more at risk, but it's one of the most active communities in the United States. And so it's interesting how, talking with some folks there, social distancing applied to the Villages. They don't do the indoor events anymore. They don't have any of the gatherings, large gatherings outside anymore. But what they do, the tee sheets are filled on the golf course because they're going out. They have their own cart. They're not allowed to shake hands. They're not allowed to touch the pin, and they just kind of do it and then go. And so it's kind of active life living in an age of social distancing, and I think it's really neat the way they've had it. And I bring that up because whatever we're doing for mitigation to do this, we obviously want to be effective. And in order for it to be effective, it needs to be sustainable. It needs something that the people will buy into and will continue to do it. And so if someone has an outlet like that that's safe and they're doing it the right way, then that's something that I think they're going to be able to really, handle this over the long term. Hopefully it's not, forever. We want to get through it as soon as we can. But I really applaud what they're doing. And we'll let you know tomorrow more. Thanks.